Welcome back to Primetime News.
Special welcome to viewers on onespotmedia.com as well as TVJ International in the Cayman Islands.
Up first this evening, the Ministry of Health and Wellness says the Cuban Eye Care program in its current form will end this month.
The announcement was made at a press conference earlier today and follows the discontinuation of the medical program last week.
Jamaica Maitland has the details.
The Jamaica Cuba Eye Care program will continue. That's the intention.
That's because the Ministry of Health and Wellness is uncertain about the form it'll take after March 20, when the Cuban Eye Care program is expected to end. It's one of the ripple effects of the termination of the existing arrangement with the Cuban government. The issue is that there is no clear commitment from the Cuban healthcare workers, at least none that the government was able to comment on at this time.
What is the take-up like, the individual contracts since being offered, and how confident is the ministry that the healthcare workers will take up some of these individual contracts?
Let me say that the conversations are continuing, and I don't think it would be appropriate for me to comment publicly on where we are in terms of numbers and so on, because I think we have to have discussions before we conclude on numbers. And it's a recent offer, and there has to be some time allowed to determine where we go and where we will end up.
Health Minister Dr. Christopher Tufton says some eye surgeries will continue as scheduled.
Its operations will continue by the Cuban team up to the 20th of March. There's an agreement on that. And for the remainder of the program's operations, services will be limited to surgery and post-operative care.
The Cuban Eye Care program has been around for decades. Dr. Tufton says the government has not lost focus of the impact, recognizing that thousands of Jamaicans have benefited over the years. He says the ministry will be outsourcing some ophthalmology services to the private sector to ensure that the program continues.
Patients, therefore, who previously received surgery under the program are encouraged to attend their scheduled follow-up appointments to ensure proper recovery and continue care. In the meantime, we are working, and I've started that, on alternative arrangements to ensure the continuity of the screening program through a combination of our internal capacity as well as through some outsourcing arrangement.
Jamaica Maitland, TVJ News.